Hello, in this section we're going to discuss advances in dentistry. The art and science of dentistry are constantly evolving. New and exciting innovations are integrated into the treatment on an ongoing basis, and the mode of dental therapy has come a long way from the traditional model. Let's then review some of the more significant recent advances in dentistry. We will focus on two areas, the area of diagnosis and the area of treatment. In the diagnostic tool, we will review the digital X-rays, the caries detection system, the three-dimensional imaging, and also some of the diagnostic tools which can detect soft tissue lesions. As far as the digital X-rays are concerned, the digital format is a very useful one. It can provide a greater comfort and certainly reduce the exposure to radiation. 4 digital X-rays have the same radiation as one traditional paper X-ray. Three-dimensional imaging is accomplished by CAT scans and other three-dimensional scans which help dentists view and operate on the jawbone with more accuracy. As implants become the standard of care in many cases, three-dimensional imaging has become increasingly specialized in dentistry. Caries detection system compensates and complements the dentist to detect caries in addition to visual detection. They detect it with more accuracy, and they scans the teeth with pulses of laser light. Decay emits a fluorescent light that is translated into an audible signal. Laser fluorescence or laser light of a specific frequency is directed at the tooth, and the amount of reflected light is measured. Healthy teeth exhibit little to no fluorescence, but carious teeth structures exhibit fluorescence proportional to the degree of caries. We also have a diagnostic tool to detect soft tissue lesions such as Velscope. Velscope uses natural tissue fluorescence visualization to help discover all mucosal abnormalities that may otherwise have been overlooked. Visulite is another diagnostic tool which identifies oral lesion and provides painless screening for the detection of small changes in your mouth. One of the least favorite procedures in the dental office is the injection of the local anesthetics. Actually, the pain is caused not by the anesthetic itself, but rather by the pressure from the injection of the liquid anesthetic. The anesthetic wand uses computer-regulated slow and gentle flow of anesthetic to reduce pain or injection. Another interesting device that has been implemented recently in dental offices is the computer-assisted design or computer-assisted manufacture, known otherwise as the CAD/CAM. This technology allows for the fabrication of dental restoration through computerized technology. A digital impression is taken using an optical or laser scanner and entered into a computerized system. This system is used to create a virtual model of your teeth and design your crown, veneer, inlay, or onlay. This process involves identifying the appropriate color, shape, and biting chewing surface for your restorations. The design then is sent via cable or wirelessly to milling unit in the dentist's office that will fabricate the restoration in approximately 20 minutes. This technique also enables a dentist to use a camera to create a digital impression, thereby circumventing the traditional impression, which is generally not very much favored by the patients. Perhaps the development of a modern implant has revolutionized the practice of dentistry in recent years more than any other innovation. While the dental implants were being placed as early as in the 70s, the osseointegrated implant has become popular in the 80s. In 1952, an orthopedic surgeon noted that he could not remove a small titanium cylinder he had placed in a bone to study how the bone healed. This special property that titanium has of fusing to bone is called osteointegration, or fusion joining with the bone, and it is the biological basis for modern implant success. Dental implants today are being used in the replacement of single or multiple teeth. They can serve as abutments for bridges. Furthermore, they can also serve as a stabilizing anchorage for complete dentures, thereby improving their retention as well as speech and mastication of food. The biointegration of the titanium tooth root with human bone is highly predictable, and the results are very long-lasting. The industry has also focused on reducing treatment time, and some implants can be placed immediately after the tooth extraction as opposed to waiting 6 months after extraction. In many instances, dental implants are now the standard of care if a tooth needs to be extracted or if there is a question as to whether a root canal procedure should be done. The use of microscope in dentistry has been one of the latest trends to perfect acute vision for the dentist. Microscopes offer the dentists the ability to see microcracks, weakened underlying tooth structure, and proximity of dental nerves with precision. The microscope is an improved diagnostic tool as well as a treatment-assisted tool. Today, this technique is used to improve the precision of surgery and root canal therapy. One of the most dreaded aspects of dental office is the dental drill. Patients neither like the vision of it nor the sound. Well, there is some research going on into bypassing this unit. It is something called air abrasion. It is used to treat small cavities. The system uses a blast of air and aluminum oxide pellets to remove decay. Often works without the need for anesthesia. In other words, there's also no needles. Bone replacement is particularly important to those patients who have weakened tooth support due to periodontal disease-related bone loss, or the edentulous patients whose alveolar process has shrunk over the years. 3 types to assist people suffering from bone loss or those requiring tooth extraction. The first one are the autografts, which are bone taken from the same patient. This bone is taken from another part of the body, such as the iliac crest, for example. The second part are the allografts, and allograft is a bone taken from another human being. This bone is taken from a cadaver and processed in a lab so that it is ready for grafting. The third part is the alloplast, which is a synthetic bone replacement material. It is made in a lab to mimic bone structure. Bone growth factors, such as platelet derivative growth factor, known otherwise as PDGF, are used in conjunction with bone grafts to achieve maximal results. The use of lasers has been increasing in the past decades. We have 4 types of lasers. The diodide, which is absorbed by pigmented tissues, such as the hemoglobin and melanin, and it is particularly good for treatment of soft tissue. There is the ND-YAG and CO2 laser, which is excellent for hemostasis, for stopping bleeding. There is the erbium laser, which is good for heart tissue and hence can potentially replace the drill, and the argon laser, which can cure resins and improve bonding. Laser surgery is an alternative to traditional scalpel surgery that can often reduce discomfort and does not require sutures. Lasers can also be used for a variety of procedures, including tumor surgery, cold sores, crown lengthening, aesthetic gum changes, tongue tie, and speech impediment and nerve regeneration. Laser may also be applied in the treatment of select dental conditions such as sleep apnea, certain cases of temporomandibular disorder, and tooth sensitivity. This is a very exciting area of development in dentistry. One of the most exciting trends, future trends, is the tissue engineering, the ability to regrow teeth. When this happens, it'll be a very exciting new phase of dental practice.